Obviously, the EU has understood that something needs to be done about cancers in general. And if you look at cancers in general, the first thing that peaks out is skin cancers, because they are so much more frequent in females and in males than any other cancers. And in countries like Australia, even though the individual treatment of somebody who has got keratinocyte cancer is not that expensive, there are so many of them actually that the treatment costs for skin cancer is more than the treatment costs for all other cancers together. And skin cancers are drastically increasing in number, something like 10% each year in quite some European countries. And it is quite clear that in a number of years, we just won't have the physicians to be able to treat all these lesions. So for that reason, it would definitely be needed that within Europe's beating cancer plan, exposure to UV, which is the main cause for skin cancer, particularly for keratinocyte cancer, non-melanoma skin cancer, and which is obviously particularly relevant for outdoor workers because they run an even doubled risk for getting these kind of cancers, that something is implemented in this beating cancer plan. And we must make sure that it is not an empty shell. At the moment it is. And the important thing is actually to explicitly put down what would be needed in terms of better prevention of the whole population regarding skin cancer, and particularly of risk groups like outdoor workers. Obviously, transplant patients are also a risk group for developing non-melanoma skin cancer. And for that reason, also they need to be included and explicitly mentioned in what is going to be dealt with the Europe's beating cancer plan. And as I said, in the moment, there's not very much in it which is too convincing. There needs to be more done. And the BECA committee of the European Parliament has already recommended that, for instance, better regulation for outdoor workers for their protection, and if they get skin cancer, for their compensation, needs to be dealt with and needs to be accepted by the European Commission for even being more precise regarding what they want to do with Europe's beating cancer plan. And if that should work out, in order to answer the question in my presentation, would Europe's beating cancer plan help to beat the epidemic actually of occupational skin cancer amongst outdoor workers? Would it help to do that? Well, that's basically dependent on us, because we definitely have to speak to on the national levels to our MEPs, and on the European level to the MEPs, and making sure that something really needs to be done and that this is an urgent matter. Maybe I can also add that we've published all the available scientific evidence that alludes to the fact that outdoor workers are a high-risk group of developing skin cancer. We have also published, and it's open access, actually. It was published in the Journal of the European Academy of Dermatology and Venereology. So everybody can look it up for free. And then also we've published a global call to action to help tackle the epidemic of occupational skin cancer, where we explicitly say what the various stakeholders, from politicians to doctors to patient groups, actually should do next in order to make sure that we have a better situation and a better protection for outdoor workers. Particularly what we want is that explicitly this should be in the recommendation of occupational diseases on the European level, UV exposure and causing skin cancer in outdoor workers. They obviously should work on regulations. At the moment, we have regulation on optical radiation, which only includes artificial optical radiation, and it would definitely also have to include solar optical radiation. And it is most likely that more than 50 million workers in the EU are highly exposed to solar UV. Outdoor workers, and they definitely need better protection. If they get the problem, they should be compensated for. Our experience in Germany is now that we have occupational skin cancer as an occupational disease since 2015, that more than 50,000 cases have been notified, about 10,000 a year. And obviously this is already the second most frequently acknowledged occupational disease from all occupational diseases. So that's something which is very frequent. It's very frequent in every European country with a fair-skinned population, but in most countries, even though there are some where occupational skin cancer can be acknowledged as an occupational disease, it is never notified. And for politicians, if there's no notifications, there's no problem. So what we really would have to do is, as dermatologists and as medical specialists, to notify the cases, to make clear to politicians that there is a problem out there and that we have to look for these poor patients, which we see every day, and who tell us, actually, if anybody had told us that we should have taken protection, we would have done it. Now we have this skin cancer as a chronic problem. They have a high actinic damage, and for that reason, they may have to see the doctor every fortnight in order to remove the new lesions. That's no fun. That's definitely a great loss of quality of life. So for that reason, protection is more than urgent.